Good afternoon, everybody. I'm here with Josh Jabal, our Chief Operating Officer, and Miguel Cordona, our Commissioner of Education, will pipe in a little later as we talk about our schools. I just wanted to go through, first of all, the daily numbers. What is interesting here? Obviously, positive cases is reflected of tests performed. I think what I found most interesting is the current hospitalized is up 46, which is a lot less than what we've seen in the past, and it continues a trend, I think the most important trend, which tells you the number of people hospitalized, and what that says about trend line, what that says about capacity of our hospitals. That's good news. Positive cases by county, again, a little misleading sometimes because that can be a reflection of cases by county. Max, you're going to move that one over? Thank you. You can see Fairfield is still the highest, New Haven, and Hartford. Next slide, please. This next chart we've gone over before. It's the COVID hospitalizations. Again, it's not a hockey stick. It's linear, and you can tell by the bottom line that the rate of increase in hospitalizations is not going up, and in fact, it may be going down a little bit, and what that says about the fact we may be reaching a peak. Hospitalizations by county, now we're getting more interesting. As you can see, some interesting evidence here. Most interesting to me is that top line, which is Fairfield County. And Fairfield County, as you know, was the county first hit. Probably they have a week or two ahead of, say, New Haven County. What you'll see at the top there on Fairfield County is not only is the hospitalization line flattening, it's down slightly, and I mean slightly. But the net increase in hospitalizations in Fairfield County, which was the most severely hit of our counties to date, hospitalization was down by one. Down by one. That means there's one less occupied bed today than there was a day ago. And as Josh reminds me over and over again, one day does not a trend make, but it is a glimmer of hope that perhaps we're reaching a peak in Fairfield County and what that says about the future. This next chart is interesting. It's admissions and discharges now. And you can see that, maybe you can't see, but let's say we've had 3,000 total admissions to date since we got hit by this virus about a month ago. And of those 3,000 folks that were hospitalized, went to the hospital, 1,250 have been discharged. So about 42% of the 3,000 folks that have been hospitalized today have already come out. They're on the mend, we hope, and healing at home, and last of their self-quarantining. Tragically, about 10% of the people who go to the hospital died, and that was a fatality number that we've been tracking carefully. We talked about that a little bit yesterday in terms of how it impacts different communities. Let's go to the next chart, I think. The next chart is, I really wanted to get into PPE. We talked about this yesterday, the protective gear, and what a mess it's been out there trying to get the protective gear. What this chart shows you is that we've been inundated with folks who have had access to protective gear. Protective gear being everything from the masks, the gowns, and you know, of those 1,000 plus that were identified, a lot of them were pretty shaky, to tell you the truth. They seemed to have a friend of a friend who knew somebody in the Ukraine. But of those, we sourced 259. We validated them. We've had 20 or 30 people doing this nonstop, 12 hours a day. And we placed 78 orders to date. And those orders are beginning to come in. Those orders are beginning to come in. Next chart, please. This tells you a little bit about what we've ordered and what we've acquired to date. You can see we've ordered about 19 million pieces of PPE, starting with respirators, N95 respirators. We got 200,000 N95 mask respirators yesterday, and those are getting distributed as we speak. And fortunately, our hospitals are also able to get a lot of their own PPE themselves. So that has given us a little bit more flexibility to get this out to first responders, nursing homes, all of our different folks in the commissions who are front-facing. We have 11,000 employees, state employees, who are still working every day, be it corrections, be it mental health counselors, and others who are on the front line. And these are the folks who are making sure we're getting the PPE, the protective gear they need. And a little bit of good news. It's a sort of just-in-time inventory, I'm afraid, because we don't have much capacity, not much of a stockpile there, but people are managing their flow of PPE really well. And we went through all the commissioners this morning, and everybody has a stock, at least to keep their people safe going forward. You heard from Barbara yesterday in terms of the nursing homes, and most of them are managing their supply of gowns and masks really thoughtfully. And obviously a few of them are not, and we're targeting them, reaching out, finding out who they are, getting them the supplies they need, and see what better protocols we can do for people. And the protocols are a broad mix. I mean, obviously, when we have COVID-only nursing homes and COVID-only correctional facilities, that saves a lot of protective gear as well, since you don't have to change it constantly as you go from non-COVID to COVID-related space. We're doing, as I said the other day, the same thing with the homeless. So I feel that we're managing our PPE really well at this point. And I think that within the next week, 2 weeks, this supply of PPE that's on order, we have a high degree of confidence. Josh has a high degree of confidence. We know the orders are coming in. I know you've heard me saying today, get redirected at the last moment, but now as supply is beginning to catch up with demand, and we'll be able to get that stockpiled out to you even sooner, and then broaden the lens of people to get the PPE as well. So it's not just our first-line responders, but let's say food service workers and daycare and others who are on the front line as well, and give them more protection as we see this peak going across the state on a further basis going forward. I mentioned to you that we have, 11,000, state workers still frontline going out there. We're going to have a terrible storm tonight. And that means we have, hundreds of extra utility folks who are also working their heart out every day, getting them the gear they need just to make sure we can keep the power going for you. So this is a government, this is an economy that has to keep moving despite what you see from COVID and what we're trying to do. A couple of other touch points. Food. We've talked a lot about food. You've read some of the articles in the national press about there's some food supplies that are being constrained right now. Not as much donation of foods, not as many restaurants open to give people food. Our supply of food right now is pretty good. I'm afraid that our food share and food bank have to buy a little more of their food than they had to before. Less of it is being donated, but our shelves are stocked at the grocery stores, and we do have the food at our food share, food pantry as well. I want you to know that. I know that there's such distress when it comes to, food insecurity. Susan Beiswitz and our Commissioner of Agriculture were at one of the food distribution places the other day, a depot, and I was told that there were 1,000 cars lined up over the course of the day there. And that's why Lisa Tepper Bates and others are trying to get volunteers and others to help in the sorting of the food and the distribution of the food. The small business loans, I'll give you just a brief update on that. We talked to thousands of small business folks today, including our representative from the Small Business Administration. Little credit where credit's due. The Small Business Administration has been very collaborative with us. We all have some catching up to do when it comes to the technology and getting these things processed. But for our loan program, that short-term loan program is a bridge to the federal loan. We've had several thousand, we've had 5,000 applications, several thousand will probably be accepted. We have a new fintech partner that allows us to electronically process these loans faster. And David Lamont believes we'll start getting those checks out to you over the next couple of weeks. For the federal PPE, the Paycheck Protection Program, there we had, Thousands of Connecticut companies applied for that. Hundreds of millions of loans are being processed. They do believe those loan payments, those are forgivable loans, by the way, for small business, will start going out by the end of this month as well. And I was just reminded on the call by a representative from small business, these loans also cover you not just for payroll, not just for benefits, but also for your state and local taxes. So you'll have some protection there as well. Andy Mays, our insurance commissioner, brought up something interesting. We're fighting every day to make sure we can squeeze every dollar we can and help you survive. 50% less traffic on our roads, 50% fewer accidents, and reduced automobile premiums going forward. So I appreciate Andy keeping an eye on that for us as well. And finally, I'll talk about dates. We had April 20th is our date where we said we'll give you notification if we think schools can open by April 20th. They can't, and Miguel Cardona is going to announce today, and I am on his behalf, that May 20th will be the new date for schools potentially reopening, at least a decision point. We'll see if we have any room between then and the end of June, as well as a small business, including bars and restaurants. I think you got to be able to count on the fact that May 20th would be the earliest that we'd reconsider opening anything. And even though we are seeing a little bit of good news, as I showed you, Fairfield County and the bending of the curve, a little more capacity at our hospitals, more PPE coming in, managing that well. I don't want us to get complacent, and I wouldn't be surprised if that May 20 date extends as well. But right now, the date is May 20. But as Miguel's going to tell you, that does not mean education is stopped. He estimates that almost every one of our school districts, most of our teachers, all of our schools are continuing learning in a variety of different ways. You know, starting in the next couple of weeks, we're going to be delivering over 180,000 reading materials, text materials, learning materials provided by Scholastic. Those are going to all of our commissioner school districts and distressed school districts to make sure those kids get the learning materials they need. That's everything from reading, learning, to a course curriculum. Scholastic is working with their teachers starting very soon to get them up to speed on how to use this material, both the book learning as well as the online streaming distant learning piece that's available for pre-K right up through 8th grade. As you know, we're also going to be providing the laptops over the course of the next couple of weeks and a learning curriculum for our high school students as well. We're going to have some really good news to announce in terms of free learning online curriculum for our college students, which we'll make available to you very soon. And Miguel wanted me to remind you that learning is about, the reading, writing, arithmetic, but it's also about the social and emotional support that our kids need. So when we're doing online, we're also doing by telephone, we're also doing by FaceTime. Our counselors are there working with the kids in need every day going forward. So nothing would have made me happier than be able to open up the schools sooner. I'm afraid May 20th is the soonest we can possibly do, even with some of the good news we see trickling over the transom. With that, Miguel, do you want to follow up on what I said on the schools?
Yes. Thank you, Governor Lamont. Good afternoon. I'm Miguel Cardona, Commissioner of the State Department of Education. First and most importantly, I hope you and your loved ones are in good health, both physically and emotionally. I address you now following significant reflection and consultation with public health experts and education stakeholders. To the approximately 530,000 students in the state of Connecticut, I would first like to address you directly. These are trying times, unlike any others we've seen in our lifetime. And your health and safety is our #1 priority. Each and every single decision we make is happening with that safety in mind. Please remain hopeful. While the future seems uncertain right now, together we will emerge from this crisis and will gradually resume some normalcy in both our daily lives and in the delivery of your education. With that in mind, and with the close collaboration of both the Department of Public Health and Governor Lamont, the decision has been made to continue the cancellation of school classes for the next month until May 20th. at which point we will reevaluate the situation and determine if returning to the classroom this year is even possible. Please be mindful that the extension of class cancellation also pertains to all school events, including athletics and any other previously planned activities. This decision has not been made lightly, and it helps protect the valuable lives not only of our students, but of our dedicated staff and the hero healthcare workers that are working really hard to try to keep us healthy. If students are sent to school prematurely, we could be sending them in harm's way. We will not resume any school activity unless it is determined that it is safe for everyone involved, including our teachers and our students. Until that time, all efforts to provide distance learning should continue. We know we may need to cancel classes for the remainder of the year, and while we're not announcing that today, we are planning for the worst case scenario. So to the wonderful class of 2020, you will have a graduation. You deserve it, you worked hard for it, and you're gonna get it. The governor and I, along with our dedicated educators, are committed to this. All superintendents and high school principals are already planning what it might look like if classes are canceled for the remainder of the year. They're also getting direct input from high school students. I heard from high schoolers last week, and I know how important this is to you. The exemplary dedication from Connecticut educators will continue, and students, you will get your moment. If necessary, it'll be postponed until it is safe, but you deserve your moment. For your years of hard work, you will get our best. I'm proud to say that our Department of Education has continued to provide guidance and support to assist students, parents, and teachers with the execution of distance learning. All of those materials are posted on the forward-facing page of our website and include resources for families and educators in supporting all students' social emotional well-being and academic learning, including English learners and students in need of special education services. Our website includes 2 professional development series, one series to assist families and another series to support districts working with specific students during this challenging time. We have information and resources available in both English and Spanish, and will continue to produce more resources as needed. We will keep focusing on our students with exceptionalities and our English learners. We know we have to continue to do better. Now, to our school nutrition workers who've served over 1 million meals to date, to our administrative staff, our teachers, custodians, our para-educators, our student and social and emotional support teams, our district leaders, and all additional district staff, I know our current situation is truly difficult to digest. What you've done in the last month has never been done before and has by far exceeded our expectations. You demonstrated to the world why you got into this profession for the students. We know you miss your students and are eager to get back with them in the school setting, but this decision has ultimately been made on a public health front with all of you and the students that you love in mind. Rest assured that I and the entire department are here to support you and continue to stand ready to provide you with the guidance and support that you need. Thank you for your service, and we're not done. With a greater sense of urgency and passion for equity and access, we will continue to educate. I'm proud to say that 100% of our districts in Connecticut are engaged in some form of distance learning, as the governor said. And I learned today that New Haven put together 1,000 packets of K to grade 2 materials for students that don't have access to technology or a computer. There's 500 packets that were created for students in grades 3 through 12 that don't have access to technology. I talked to the superintendent in Sonia about an hour ago, who said that they've worked to distribute packets of information for students that don't have access to technology. And I know countless districts are doing the same, in addition to the 187,000 packets of instructional materials that are on their way to Connecticut to be distributed, as the governor mentioned, thanks to a donation from the Newey family and to the work of Scholastic. And that's in addition to the 60,000 laptops that the Connecticut Partnership agreed to purchase for our Connecticut students. Thank you. I read yesterday, and it's worth repeating, virtual teaching will never replace the love, laughs, learning, and the smiles on students' faces and the aha moments that happen in actual classrooms. The quarantine is not a break for teachers and students, it's actually heartbreak. And as Ben Opry said, the most authentic thing about us is our ability to create, to overcome, to endure, to transform, to love, and to be greater than our suffering. We will get through this together. Thank you.
Thank you, Miguel. Any questions, Max?
We'll start with Sue Haig from the Associated Press.
Hi, how are you?
Hey, Sue.
Governor, regarding the PPE, you said that you are, a lot of it is coming in. Did Connecticut work with other states? What do we do in order to get this stuff? Is it all just working directly with ordering it from businesses, or did you have to do something, pull some strings somehow?
Well, I'll start, and then Josh can pick up. We're working very closely with our other New England states here, helping to vet, helping to source. As you could see, most of the offers have to be, let's say, carefully vetted going forward. You see that overwhelmingly, by far, most of the PPE we get going forward is going to be what we have been able to privately purchase. And for lack of the federal government taking the lead on this, we're working on a regional basis and also directly. Josh, you want to add?
Yeah, I think, as the governor said, Sue, it's kind of all of the above. We've placed several orders in collaboration with other states. We've been working through our usual distributors who candidly have not been delivering on time as committed, and so we've moved to alternate models, working with companies who have relationships with factories in China who have been generous with their time and connections to help connect us and orchestrate deals. So we've really been turning over every stone, chasing every opportunity, and as the governor said, I think we're getting close to seeing a very significant wave of PPE coming into the state. But in the meantime, as the governor said, we do have enough. We've been supplying, the people on the front lines and have ensured that everybody has some supply, not as much advanced lead time for the supply as we'd hope, but we're going to get to a more comfortable position soon.
And how much have we spent on this?
So of the 18.8 million units that the governor quoted, those purchase orders represent about 50 million of spend. And it's worth acknowledging that 75% of that's reimbursable by the federal government.
Thank you.
Next question from 1080 WTIC.
Guys, can you hear me?
Yes.
Mr. Governor, the two contrasting, predictions from two North American leaders. The president seems to be anxious to, as he puts it, get everyone back to work, and I'm sure he's disappointed about Easter and all that. The Canadian Prime Minister, Justin Trudeau, said today Canadians are going to be inside for months, and he sees this going well into the summer. Where are you on that spectrum?
I want people to get back to work as soon as they can do so safely. I do worry that if we rush back to work, as some of the rhetoric has implied, you could have a second and third wave of this pandemic. So we'll be outlining over the next week or two how we carefully plan to get people back to work, antibody testing, and do it on a safe way. We're just not going to open the doors on May 20.
Move on to Fox 61.
Hi, Governor. We're getting discharge numbers from hospitals, and the data you provided today, we saw that percentage. But when can we see recovery numbers? And if so, explain the difficulty behind getting accurate recovery numbers.
Want to talk to that?
Yeah, there really isn't a mechanism to track all recoveries. Keep in mind, the majority of people who get diagnosed with COVID-19 never go to a hospital. They're sent home to self-recover. There's not a mechanism to track every one of those people. And even then, as has been pointed out by our public health team previously, even the people who are tested is just the tip of the iceberg. There's many people who will get it, may not even exhibit strong symptoms, or will simply stay at home and self-recover. So we don't have the instrumentation to track every single person who gets it and when they recover.
And Kurt Westby yesterday mentioned the Department of Labor is working on another technical fix. He called it Plan B. He said you guys are testing it right now, and if launched, it could cut the time frame for unemployment claims to 2 to 3 days. Is there any update on that?
I think it's looking pretty good right now. He has already processed 130,000 claims. Obviously, there's over 300,000 in, so we have a backlog to go. And right now, the technical fix is working, and you'll be getting batches of emails out to different people, seeking unemployment comp to send back, and we're turning that around very quickly. I'm hopeful, he's hopeful that if this keeps working, we can clean up the backlog in a couple of weeks.
We'll move on to Hearst, Connecticut Media.
Thanks, Max. Hey, hi, Governor. Can I ask you what you think about the immigrants who are here without legal status? There's a petition going around, and these are our neighbors. And what kind of things are you thinking about to be able to help them?
Well, I was very happy to hear the White House say and the COVID force say without any question that undocumented immigrants are safe going to our hospitals. No ICE there, nobody picking them up. Because there's nothing more important than if you're feeling ill, get a doctor's prescription or get a permission anyway, but at risk, you go to the emergency room, you go to a hospital. We don't want more people walking around infected because they fear they wouldn't be safe going to a hospital. So that I can give you strong assurance has been cleared up.
Thanks, Governor. And when you're talking about the 1,250 people who are discharged, how sick are they when they leave? I mean, they're off the ventilator for X number of days, or are you that granular in your knowledge at this point?
I don't think I'm that granular. Josh can probably help me out with this. But you go in there, and those are the people that spend anywhere from a week to 2 weeks. Some go on a ventilator, some don't, but they were tested positive for COVID. And we got them to a place where they're probably safer going to an intermediate facility, or in this case, going home to recuperate.
Thanks, Governor.
Hartford Current.
Hi, Governor. First of all, the federal government said today that they are pulling back federal support of testing sites. How, if at all, will that affect testing in Connecticut?
I think our testing is going to continue to ramp up. I think you heard yesterday talking about getting the CVS, Abbott Labs, 5-minute test, 15-minute test going in Stamford and New Haven. And I'm not quite sure what they mean by what the federal support's going to be. We're getting our own reagents, we're getting the material, we have our own hospitals doing this work. I think we're going to keep ramping up the testing. And testing is going to be a big part of our long-term solution, getting Connecticut back to work.
And then also, and maybe this is a question for Commissioner Cardona, we've heard that there have been disputes with school bus companies if towns are not willing to pay the companies because they don't have any students to drive. Can you tell us anything about that, or what's being done to, if anything, to make sure that bus drivers are paid?
Sure. So, one of the important pieces of the executive order was to make sure that we could keep as many people whole as possible. And we stand by that 100%. I don't know that disputes is the right term. I think we're still working on what that looks like. And I have to say that we've been collaborating not only with all folks on different sides of the conversation to make sure that at the end of the day we're staying true to the intent of the governor's executive order, while also taking into account the fact that many districts are now grappling with needs to provide different types of resources that they didn't before. We want to make sure that we're working to support both our bus drivers, our bus companies, but also make sure we're honoring the contracts and the language in the contracts that speaks to keeping our bus drivers whole.
Thank you.
We'll move on to CT News Junkie.
Sorry, guys. So can we go back to PPE for a second? Governor, earlier on you said that everybody has enough stock. If that was true, why did this private organization, Masks for Heroes, have to go out and supply over 100 nursing homes with surgical masks?
What I said was we were managing the limited stock we have and making sure, Christine, that we manage it until all of our supplies start coming in. So this not-for-profit, I thank them so much for going forward and refreshing people's stock. I think almost everywhere they've got 2, 3, 4, 5, 6 days of stock, but that doesn't give you the confidence that you're there on the back side of this. So I really appreciate the donation that they made.
And do we have the, on the PowerPoint, the 18.8 million units, do we have those, or are those the orders that we put in and asked for?
That's the latter. That's what we have ordered. But as we implied before, some of these we ordered, 5, 6, 7 weeks ago. And you say, all right, why are you more confident today than you were, a month ago? And that's because the supply out there is beginning to catch up with the demand. Josh has been sourcing this really carefully. And we received 200,000 masks yesterday. I think you're going to see more supplies coming in faster and faster. This thing could drag on, for a matter of months. And I'm going to make sure that we have a stockpile in place. We never have to, live managing our resources like we've had to the last few weeks.
Move on to NBC Connecticut.
Hello, my questions are for the Commissioner. Commissioner, I'm wondering if you've been able to quantify at all just how much learning is potentially being lost here during this closure, obviously recognizing the fact that these districts have practically overnight had to implement this long distance learning, which of course would normally take months or even years to implement. But I ask this question because it seems like there's a great degree of discrepancy between districts when you compare the workload of students. In some communities, parents tell me their high schooler is done by noon. And then in others, I'm told they're actually receiving live instruction from teachers until 2:30 every single day. So can you tell me, as we seem to be in it for an even longer haul, do you expect to release new requirements for districts, or will you just continue to leave it up to their discretion?
Well, we've been working very closely with districts to identify what the needs are and how they're providing instruction. You're absolutely right. We went from being in the classroom to doing something that has never been done in education in 3 weeks. And I tons of credit to these educators who have done everything in their power to meet the needs of the kids, not only academically, but socially and emotionally, right? As a father of 2 students that are in public schools in Connecticut, I can tell you that my students, my children haven't missed a beat, but I know that in Connecticut, there are many students who still don't have access. This is really bringing up equity and access issues in Connecticut that we know are critically important. And as I said earlier on our call with superintendents and with board leaders, we have to really make sure we come out even stronger with a sense of urgency around equity and access in Connecticut. We are working very closely with those districts that said, we're struggling with this, we need more support. And what we're doing is we're learning. There's some districts that are doing some amazing things that can really help support another district's capacity to do that work. So we have our thumb on the pulse, and we are going to continue as an agency to do a better job, not only reacting and supporting the needs, but coming up with some acceleration for students that have missed learning or have not had good access to learning. And this is not going to be fixed in the fall. This is not something that's just going to be, we're going to go back to business as usual in the fall. There's going to have to be a need for acceleration and remediation for lost learning for years. And we're committed to doing that. Right now, we're learning from districts what the needs are, and we're employing our staff to provide them with support and resources so that we can close those gaps of experiences in Connecticut.
Have the 60,000 laptops been distributed yet?
No, the 60,000 laptops are going to be on their way to Connecticut. We have a dedicated team of superintendents and educators that are working on the logistics of that, working with the companies that are creating machines, getting them ready for our students, and we're going to be doing it expeditiously, but we're also going to be doing it safely. I think it's critically important that while we get it out quickly, we want to make sure that we're getting it out safely. So that'll be coming out. I would anticipate May, late April, early May. But the Scholastic, as the governor mentioned, the Scholastic materials will be out in the next week or 2 weeks.
Is there a backlog to order them? Because I know every state is trying to order extra Chromebooks for their students.
I don't have specific information on that. I know Connecticut was prioritized by the developers.
Move on to Channel 3 Eyewitness News.
Governor, with the May 20th date, this means that unemployment trends are going to go on like this for at least another month. We already have that 6-week backlog at the Department of Labor. How will the state be able to keep up through this next month?
I think we're compressing that backlog every day. This is true of a lot of other states where I think we're ahead of the curve on this. I think the fix is working. I like to think we're going to have that caught up over the next couple of weeks. But you're right. I got to believe that this trend of unemployment claims cannot go up at the same pace for the next 3 weeks it did for the last 2 weeks. That would be unsupportable.
And then really briefly on the recovery numbers, if the admissions and the discharges are really the only metrics that we're being given right now, can you kind of put that into perspective for us in terms of what the medical community is saying? Are they happy with these numbers? Do they suggest that we are on track?
I am encouraged by these numbers. You know, we thought that this surge may go like this and may go for, a few more weeks, just looking at, Wuhan and Italy and other places. So I am encouraged by the fact that the social distancing, which we started very early in this state, may be paying off. And the fact that you have one less hospitalization in Fairfield County, I'm hoping is an indicator of things to come. You have something to add there? Or?
No, just I think that the hospitalization trends are consistent with what we've seen in other parts of the country and other parts of the world. It's important for people to remember that 80 to 85% of people who get COVID-19 will never show up in that pie chart. They'll never be admitted to a hospital. They'll recover at home. But of those who are, you can see that 80% of them are recovering and going home healthy as well. So I think it's been consistent with the overall trends.
Moving on to Connecticut Public Radio.
Thanks. Governor, going back to the Department of Labor, you've spoken over the past few weeks about the department making some tweaks, some fixes to its old computer systems to support new jobless claims under the CARES Act. I'm wondering if you can just provide a little bit more detail about what those tweaks were and if there are any self-employed workers who should maybe wait to file an unemployment claim until those tweaks are fully in place.
I think we're going to know the tweaks are it's a technical workaround. It's a way to simplify the processing, and it works within the existing old 40-year-old COBOL system. I can tell you that we've had COBOL experts from around the state have gone in to help do this. You heard our commissioner say yesterday that we've gone from 20 to 80 plus people also manually doing this as well. So I think we're catching up every day. Can we handle this load if it continues to accelerate at the rate it's been? So far, we're doing that.
I would like to just clarify, though, one thing you said, which is the new benefit for self-employed, the PUA, Pandemic Unemployment Assistance. That is a brand new benefit. No state has any capacity today to process that through the system, and like every other state, we're now in the process of standing up an entirely new system to be able to do that. So that will take a little longer, but as the governor said, for the more traditional benefits, these workarounds and more automated paths through the system that the Labor Department's implementing will help get a lot of additional money out to people quickly.
The day.
Hi, Governor. Julia Bergman from The Day. On the PPE slide, there was 1 million units listed as other. Can you describe what's included in that? And does that include testing components? I know there's a critical shortage of swabs and other components nationwide. And is Connecticut running low on those supplies?
Yeah, other things in that other category are things like goggles and other hazmat suits and thermometers and a wide variety of other items that we're also working to procure. You're right that the swabs have kind of emerged. I mean, this is the nature of this is on any given day, what's in supply and what we've received orders and what's kind of a shortage is always kind of changing. As of today, you're right that swabs are one that several have surfaced as a limiting factor and getting of concern in terms of advanced supplies. So we're constantly shifting our focus from a procurement perspective as the trends require.
Josh was explaining to me that we're pretty good on gloves right now. N95 respirators and other respirators, we're fairly confident that we're going to be in good shape there, 7 to 10 days. And most of our facilities have 7 to 10 days right now in stock. If there's one place that we're looking right now hard is on gowns, especially the more sophisticated ones. That's maybe where we have a short-term shortage.
Move on to the... Oh, sorry, Julia, go ahead.
Your office has started to break down lab-confirmed cases and deaths by race. Is there any plans to do that for the testing itself and who's getting tested?
Yes, in the category of the testing, we're at the mercy of the people performing the tests and making sure that the forms are completed correctly. And we've seen in many cases that's not being done. So our public health team has been trying to go back and ensure that people are filling that out. But that is that is an area where the data is incomplete currently.
But we did want to have those CVS sites set up in Stamford and New Haven to make sure that a more diverse community is being tested, and we know we can count on that.
Move on to the Waterbury Republican American.
Thanks. I got a question on the school closures. Under what circumstances would you allow the schools to open after May 20th? You just said a few minutes ago that this is supposed to last weeks and months, and the charts that you showed us, I believe on Friday, basically showed this outbreak, or at least the first wave of this outbreak, carrying on into early July, and there's concern about a second wave. So under what circumstances would you open schools? What would have to be the conditions?
Sure. So the decision to cancel schools for a month is one based on what we know we can communicate now. We are working very closely with the Department of Public Health to make sure that we don't open schools and put people at risk. But, if you make a cancellation now, there's very little opportunity for us to go back. If there was any sliver of opportunity to get back, we are going to follow those numbers, and as I said earlier in my comments, we are planning for the worst. We are planning for potential longer cancellations. But at this point, it's safe to say that we're not going to be returning before the 20th, and we're going to look at the data as it comes out. And the latest you're going to hear about further cancellations would be right before May 20th. But you would probably hear sooner if the decision is made to cancel further into June, but also throughout the summer for summer school or any compensatory planning.
So is May 20th going to be the date that you're going to decide whether or not schools will resume through June 30th or not?
It would likely be before, because like we did today, we want to give districts ample time to plan. We want to give families ample time to plan.
Okay. And I had another question for the governor and Josh regarding SNAP benefits. We were just talking a few minutes ago about the surge in the unemployment claims and the ability of the Department of Labor to process them. What is happening in terms of SNAP applications? I believe the amount has tripled from, I think, 150 a day to about 450 a day.
Yeah, Deirdre told me that the number has about tripled over the last couple of weeks. We've also upped the cap, so people can buy a little more than they could before, depending on what category you were in.
We don't have a significant backlog there, though. That team has been staying on top of it. They've been teleworking, and we don't have a huge backlog of processing there.
We'll move on to News 8, WTNH.
Governor, Bob Wilson, I was just wondering, and maybe this is for the commissioner, are you considering changing grading to pass-fail? And Commissioner, you mentioned graduation. What might that look like? I know you're taking input from students, but what do you think it could look like?
Sure. Thank you for the question. So graduation, we've asked superintendents. So we heard from students last week, and the next day we communicated to all superintendents, please start engaging your high school seniors to listen to them, what they value, what they would like to see for graduations. So we know that the conversations about what it might look like will have input from our students, and that's critically important for us. It could be a postponed graduation. It could be one in the fall. Depending on when it's safe to get people back and what they really value, that will determine what it looks like. With regard to grading, yes, we know students have different access to the online learning now or the materials. So we have to make sure we're fair to our students, fair to our learners. So we've given districts some guidance on what we would recommend, and that guidance has been supported by our colleges. I think it's important for parents to hear that the impact of the coronavirus should not have an effect on our students' ability to go to college. So we work with our colleges to make sure that whatever recommendations we're giving, whether it's pass-fail or a pass incomplete or a pass with distinction, is something that our colleges also accept.
And did you make that recommendation?
The recommendation was made to districts yesterday to give some consideration to different options, such as pass-fail or pass incomplete.
We'll move on to the Connecticut Mirror.
Hello, I was curious about, as the decision has been made to cancel school through at least May 20th and potentially longer, I was curious if there's any consideration to increasing the amount of summer school that would typically be available, or having school next school year start earlier, or any sort of way to make up the time that's currently being lost in the education that's being lost during this time. And then the second question that I have is about the CARES Act and whether or not the administration has begun to figure out how they're going to spend that money for education that has been earmarked for that.
I'll start on that,
Jackie,
then
yes.
Miguel, you pick up.
Okay, go ahead, Governor.
The Connecticut Partnership, I've strongly recommended we think about funding a back-to-school program before school begins for those kids that may need a catch-up, for those kids that may need to socialize going back. And I think that's something we're strongly thinking about from the partnership side. Miguel?
Yes, thank you. Good questions. We know that the impact is going to require that we do things differently. So we at the agency are going to work really hard to try to develop resources and support for districts to engage students in over the summer. We're also, as the governor mentioned, looking at creative ways of trying to create a bridge program for our learners so that they can be starting school better prepared. So this is ongoing conversation. And, you know, we're fortunate in Connecticut. We have so many partners that want to help and that want to assist with this. So I know we're going to be counting on our reps to help us develop some programs for our learners to re-engage earlier.
Thank you.
All right. That is everyone.
Right, everybody. Thank you very much. Miguel, good to see you. It's another day, and another day where we see some slight glimmers of hope. And I hope this is a trend that will continue, and as we think about what happens the day after. Take care, everybody.